Well, welcome back, everyone. We know Botox can help to reduce those fine lines and wrinkles, but there are also some other benefits to Botox you may not know about. Dr. Jeffry is here to talk about those different types of treatments. You are a local cosmetic surgeon, a plastic surgeon. Welcome.
Thank you.
Thank you for being here. You know, we've all heard about how Botox can wipe away some of the lines, but I was surprised to hear about some of the other ways that is being used. It can help your neck bands that many of us have.
That's correct.
How does that work?
Well, the Botox is a paralyzer of muscles. So anytime you have a muscle that's prominent that you don't want displayed, by injecting Botox into it, it will soften the muscle and give you a smoother contour.
Now, Botox has been around for many years. It was initially used by ophthalmologists to help in that field. But cosmetically, it's been used for how long?
Well, it's been approved since 2004, but it's been used with the periorbital muscle relaxation. Dr. Carruthers in Canada started using it for other parts of the face, and so it evolved from that original use.
With all the injectables and other options that women and men have these days, are you finding that the request for Botox has dwindled, or is that not happening?
No, it's actually huge. There's, I think this decade is the age of non-invasive anti-aging technology. And people don't want surgery. They want alternatives to surgery. So Botox complements this desire very well.
And is it still true that Botox lasts about 3 months?
It does tend to last. The more injections you have, it does tend to increase the length. And it can, after several injections, go to as long as 4 to 6 months. But that would be the maximum. It does not last forever.
Right, right. All right, let's talk about some of the other areas being used with Botox. Slim your calves. It slims your calves? How does that work?
A lot of people don't like the contour of their calf that's too muscular. And by having local injections in the superficial layers of their muscle, it softens that strong calf muscle, so it gives a smoother line, a little longer leg look, and a more attractive appearance.
Wow, who knew? All right, we've got some before and after pictures that we want to share with our viewers, and you can just comment on them as we see them. This is a very common way that people utilize Botox.
Yes, we find around the eyes, the periorbital area, and the crow's feet, or the forehead, or between the eyebrows. Those are the most common areas until we now have found so many more uses. But this is usually a softening and raising the brow, a more youthful appearance, softer, less wrinkles. Wrinkles from sun damage or aging tend to be associated more with an older appearance.
Right, right. And we should keep in mind that Botox is something that actually paralyzes the muscle. It's not a filler. That's a whole another product. Okay, look at this one. It's are men turning to Botox more?
I have a very large male practice, and sometimes half of our patients are male.
Look at, he looks friendlier in his after picture.
A lot of people like it. You can also change a smile into a smile from a frown, or make a softer look so that people don't have that mean, angry look that frightens people when they're dealing with the public on a daily basis.
It's not a good thing for business, is it?
No.
Wow. And here?
This is actually a newer technique that is called lipo reduction with radio frequency, and this is a tightening unit that is sort of like a microwave. If you put bacon into a microwave, the fleshy, yeah, right, and that's exactly what this. It heats the tissue up, non-invasive, no anesthesia, no surgery, and once again, for that group of people that don't want surgery, it tends to be a softer look and less expensive and no cutting.
Do you think, you know, people are turning more to non-invasive procedures, mostly because there's less downtime, it's less costly, and people just don't like to be cut up? Do you see this as the wave of the future, where someday facelifts will be obsolete?
Oh, I think it's definitely going in that direction. I just came back from a course in Newport Beach on the facial plastic surgery doctors, and there was so much more input on non-surgical techniques. They still are talking about surgery, but that's the direction.
But you know, I have to tell you, doctor, that it kind of creeps me out a little bit when thinking about injecting like something in my skin. Botox doesn't scare me, but some of the other injectables, you know, just putting a foreign substance in there to fill out your skin, there's something a little creepy about that to me.
Yeah, there's all sorts of, there's bone, there's microparticles, there's human cadaver specimens, there's injections from cows, so there's a lot of different varieties. And the Sculptra is the latest thing that people are using, which is actually a polylactic acid, and it tends to last for up to 2 years. And it's used in a lot of suture material for years, and it stimulates it. It's not a foreign substance.
What about the safety? That's, I guess, what kind of worries me. Do we know the safety records of a lot of these things, or are we we're kind of experimenting with them a little bit if we take part?
Well, the good thing about the FDA in our country is that they're very strict. So usually something comes here after it's been in Canada and Europe or Israel or places, and so there's a pretty good track record.
Yeah, I guess it just depends on your comfort level.
Exactly.
Well, gosh, it's great to know there are many options and they're non-invasive. That's an important thing for a lot of people. Dr. Jeffry Schaefer, thank you so much. And for more information about Dr. Schaefer and his cosmetic surgery practice and some of the treatments we talked about, you can go to KUSI.com. Thanks so much.
Great,
good to see you.
Oh, you made me look good.
You made me look good. All right, well, don't go anywhere.